human papilloma virus. It is one of the measures of preventing the cervical cancer. So it is all women of reproductive age that can be affected by cervical cancer, but more so women that are above 35 years. But once somebody gets into or gets infected or gets into contact with the human papilloma virus, which is the virus that causes cervical cancer, it can stay in the body without affecting this woman for around 10 to 15 to 20 years. So during that period, even if the woman who got into sexual relationship when she was as young as possibly 15 years, we realize today women are getting into relationships when they are very young. This woman may stay for around 10 to 15 years before she's infected, and therefore possibly by the age of 35 or 40 years, or even earlier than 35 years, that is when this woman would now possibly get the signs or come for the normal screening, a healthy screening, and then we get her to be having the cervical cancer. Yeah, I have said H. Thank you. I have said HPV, or HPV is a virus, human papilloma virus, and naturally, human papilloma virus is usually found in the pubic area of men. But now, because of the relationship between a man and a woman, for the man, human papilloma virus is a normal flora. When I say a normal flora, ni kitu ambacho mwanaume anaweza kukaa nacho na kisiwe na madhara kwake. But when it gets to a woman, then now it can cause the cervical cancer to the woman. It is infectious to the woman, but the man, it is a normal flora. So once a woman gets into relationship with a man, as they continue with the time, now this human papilloma virus gets away now from the man to the woman. And now when it comes to the woman, with the time, it could infect this woman, and now she ends up getting cervical cancer. And when we are talking about HPV vaccine, now this is a vaccine to prevent this woman who possibly has or may get the cervical cancer from getting now the disease, who may get the human papilloma virus from getting the disease. And how do the vaccines work? When we give a woman or the children, like we give our children vaccines, when we give them antibodies. The vaccine usually contains antibodies that when this particular person gets the vaccine, once this woman or this client one time will get that virus which the vaccine is preventing, it will act as an antibody or like a soldier which will fight away the bacteria or the virus that is bringing the disease to this woman. Thank you. When we look at our data, we have many women that have been affected by human papilloma virus and hence the cervical cancer. When we look at our data, I'm sorry, I don't have the exact data. I should be having it next time. When many women have been affected by human papilloma virus, hence having cervical cancer. And that is why we are concerned. Go to our hospitals or to our facilities. We have very many women that are, some of them dying of cervical cancer, others are already affected with cervical cancer and undergoing treatment. So why should we be concerned about cervical cancer? We should be concerned about cervical cancer because at a higher level, or at most, cervical cancer can be prevented with simple measures of women going for a healthy screening in the health facilities. After being screened at that facility, You may be found you're not having any infection, or you may be having some lesions. That is the primary levels of being infected. And when we get you at the early stages of infection, we are able to take you through treatment or through management, and then you end up being a survivor of the cervical cancer. Cancer presents itself in four stages. There is stage 1, there is stage 2, there is stage 3, there is stage 4. And when we get a woman or any client in stage 1 or stage 2, we are able to manage this woman successfully, and this woman becomes a survivor. But when possibly we get you in stage 3 or stage 4, it becomes a bit challenging, because it will already have advanced to a stage which possibly we may not be able to manage you efficiently. This is a woman who may need to go possibly through surgery, through chemotherapy, through radiotherapy, and possibly get more management. And that is why we are encouraging women. It is always good to go early in advance, to be screened, and in all our health facilities, not just in Nakuru but all over the country, from the level 2 facility, that is the dispensary, the health center, the level 4 hospitals, and even the level 5 and the level 6 hospitals. We are doing screening to our women, just to ensure, in case we get a woman who is in her early stages, we are able to manage this woman. And I appreciate that our government has made arrangements that we can get the services to be able to manage these women who comes to us early in advance. And in addition, as today we focus on HPV, or human papilloma virus vaccine, which was launched in 2019, that is around 5 to 6 years down the line. It is we usually say vaccination is the sure way of prevention of any communicable disease. And if we can be able to prevent a cervical cancer, it is very possible for the women, the children that we started vaccinating in the year 2019. By the time they become women of reproductive age, we are very optimistic that we shall get women who will be free of cervical cancer then. We are counting data, we are counting the years as they go, focusing that the very girls that we got first in 2019, by the time they become of age and they get into marriage, these are women who will be survivors of cervical cancer. I want to say categorically no. It doesn't cause cervical cancer, and that is why, alongside the other management that we're giving women, we are still giving them family planning. Family planning or contraception is a method of helping a woman to be able to get a child the time she has planned to get a child, and to get the number of children she wants to get through her lifetime. So I say it doesn't. Mm. Thank you. You have started with a very good question asking what is HPV vaccine. And just to emphasize on what I have explained, that human papilloma virus is a vaccine which is an antibody that is given to girls who are 10 years. That is where we started. And we say 10 to 14 years or 10 years. And when we give the girls this vaccine, they get the antibodies. That peradventure, they will get the human papilloma virus, and it becomes infectious to them. These antibodies that we have already introduced to their body, they will be able to fight back, and this girl will end up not getting the cervical cancer. Why do we focus on girls that are 9 years or girls that are 10 years? We are focusing on the girls that we presume they are not sexually active, because the human papilloma virus, we're not supposed to give the women that are already sexually active, because they could already be having the virus. I explained very well that the human papilloma virus is usually the pubic area of men, and because of the relationship of a woman with a man or his partner, then the human papilloma virus could move from the man and out to the woman, and to the woman it becomes, with time, it can become infectious. And by the grace of God, there are women who has lived with their men all the years and they have never been infected, and that is why I said it could delay. And now, why we focus on these girls, we presume these girls are not sexually active. Because, for example, the girls that are already sexually active, in case we give them the human papilloma virus vaccine and they could already be having the virus, it's like catalyzing the virus because they already have it with them. But we are presuming the girls that are 10 years, and that is why we are reaching out to them, they are not having the virus. Otherwise, any other sexually active woman who would wish to get the human papilloma virus vaccine to prevent herself, she should go for a human papilloma virus test, just to affirm that she doesn't have the human papilloma virus with her before she gets the vaccine. That is a story for another day. um, um, uh, they can benefit, but we presume nowadays our young children, which is not okay, they engage themselves with sex when they are very early. And that is why we presume possibly the girls who may not have involved themselves with sexual activities, they're the girls that are 10 years, and that is where we start at that age. And I know in the history of the Kenya reproductive health, we have had girls as early as 9, possibly 9 years, 12 years, 15 years, who have become teenage mothers. And therefore we presume that the girls that are 10 years have not involved themselves in sexual activities. I hope I've explained it in a way that people can get, because when you have already involved yourself in the sexual activities, we presume you could already be having the virus, and therefore giving you the vaccine, it's like activating the virus that is already in you. So, in case a woman of age or a woman who is already sexually active would wish to get the human papilloma virus, she would first be needed to go for a test to test whether she's having the human papilloma virus or not, and then if not, she will then qualify to get the vaccine. So even them, they can benefit, but after following that procedure. Mhm. Thank you, Chela. There's so many myths that people have attached with the human papilloma virus, and that is one of the hindrances that we have been having, even when we are reaching out to our girls in the schools, in their homes, in the markets, in the facilities, because there are a lot of myths. Sometimes people say it is a vaccine that has been brought for people to trade with in our nation. Those are some of the myths that we hear. Some other people say it is a family planning. Why are we giving it just to the girls alone? And many other. I wish. I hope our audience would put all these myths, and then we go unwrapping them on the platform, because there are so many myths that are attached to that. And actually, when we do like what we're doing tonight, creating awareness, we just create the awareness to let people understand what we are talking about. And even when we go to give the vaccines in our schools or in our institutions, or even in the markets, or even in the community, because we reach out, we do our outreaches in the community, in the institutions, in the markets, and also in homes. Sometimes we reach out to the homes to create awareness, and especially through our community health promoters, who are stationed in the community. We just try to create awareness and to let the women understand and know the importance of of the vaccine, other than embarking and holding onto the myths and misconceptions. And but we always know and understand that people will have these myths and misconceptions because they don't have the information, and therefore a platform like this gives them a good platform where they can be able to get the information, and possibly do away with the misconceptions that sometimes they usually hold to. I can answer that, and I would say those are myths without basis, because, like I said, we just started giving the vaccine in 2019. And when we started in 2019, that is around 5 to 6 years down the line. I don't think even the generation that we gave the vaccine have already gotten into the reproductive age that we can say possibly we gave this generation, they have gotten into their marriages, they have not got children. So I would say these are myths that are having no basis, and these are just things that people talk out in the community. And I appreciate that we have a platform like this when we can be able to explain to them about the issue of making the other one that you have said, that we make the girls is it go for sex or feel sexually active. That is also another myth without basis, because it is not related in any way to that. And the best part of it is that as we give out the vaccine to this particular generation, we usually do health education focused not to girls alone, but also to the boys that they are schooling together with the population that is in school, even with our teachers. And I appreciate so much, you go to those institutions, you will meet our health teachers very active, because we have empowered them with information together with the health clubs in the schools, that they don't wait until the day that we shall go back there to tell the children or to inform the children, but they can always continue with the information to the children even when we are not in school. So I would, Chela, say that these are myths and misconceptions that do not have any basis, and we can prove by saying the children, possibly if I got one child and I gave the vaccine when she was 10 years, right now she's 15 years. This is a girl that is still in school, but possibly after some years to come, we can do research and get the data. But right now, those are myths without basis. But they are varied. Sorry, I would say they are varied, because when they come up, they give us a platform to empower our population with information. So I would still say they are very varied myths, because they give us a platform and information to know how to reach out to our community. Human papillomavirus I mean, vaccine is very safe. We have been giving it for the last 5 6 years, and for all those years, we have not had any side effects that have gone beyond or they have not caused any alarming side effects. Every vaccine has got side effects, because these are chemicals or antibodies that we are introducing to the body. And I said they are soldiers that are ready to fight when there is any infection. So to particular recipients of the vaccine, there are those who could receive the vaccine and immediately have some reactions, like having a headache, feeling malaise, that is feeling general weakness. Not always. There are those who would receive the vaccine and possibly feel like something has happened in their body. Some of them will have a lot of fever, but it depends on particular persons. But we usually do, whenever we give any medicines, whenever we give any vaccines, we usually educate the recipients that peradventure they would receive any of these side effects, they come back to us, and we have protocols on how we handle any side effects that goes beyond board, because we would also like the Department of Health to be able to assess and to know the of to understand or to have a research and find out the quality of the vaccines or the medicines that we are giving to our children. So far, I would certainly and confidently say that human papillomavirus is very safe. We have been giving it for the last 6 years. We have not had any side effects that have gone beyond board. Research has been done, and so far, it is very safe. And I said side effects are normal. And so far, I would say also confidently, we have not had any side effects that have gone beyond board. Exactly. They should be able to visit the immediate health facility that is near them for any first aid or for any help, or visit and even when they get there, we will also reach out to the facility where they received the vaccine, because we need, when we get such a side effect which goes beyond board, we usually take the number of the vaccine that we had given, we call it a batch number, and then it is taken through the protocol, because we also take history, we take care of the client. First of all, we reassure the client, and then we will watch over the client to see whether it is the vaccine that has caused that, because there are those we say it could that has caused, is it could be the procedure that we used, it could be a coincidental, possibly this client was having any other problem, and coincidentally the time that she came to the hospital to receive the vaccine, because of the reaction now of the vaccine, it brought out the issue that was in the body of the client. But we usually have very good procedures that we do, and very efficient and very immediate, because we would also like to know the efficiency of the vaccines or the medicines that we are giving to our clients. So peradventure somebody has been vaccinated and you get fever or you get a headache, it is always very wise to go back to the facility where you are vaccinated, or even before you reach there, if it is far, get to the immediate facility which is there, which can be able to give you any first aid or any help as we reach out to follow the protocols to see where the problem is. And I have said so far, we have not had any client who has got any side effects that have gone beyond board. Otherwise, possibly we would already have had a signal of not to use the vaccine or something of the sort. So far, we are safe. From where we stand, and before it was brought before any vaccine is brought to the market or is brought to the users or to the consumers who are clients, it is usually proven, because we don't bring it to test on the consumers. We bring it when it has already been exacted through testing and through a lot of testing and through processes. And for your information, any vaccine, even when it had been tested elsewhere outside the country, when it alerts to Kenya, before we still give it out to our population, it is usually exacted through examinations. And that is why we have institutions like KEMRI that does that work. So it is 100% proven that it is able to prevent cervical cancer, and that is why we give it out to our population. So we are not we are not giving it to test on our children. We are giving it out because we know it is 100% safe and it can prevent our children. And I said, as I started, Sheila, that you're very optimistic and looking forward anxiously that by the time this generation that we started vaccinating in 2019 become of age and become women and men of reproductive age, and they get married and they start getting their children, our hearts are like expectant, our hearts are excited, because we can't imagine how awesome it will be that you're having a generation of women that are not suffering with cervical cancer. We are, as healthcare providers, we're so much expectant, we're so much ambitious, waiting for these years to come, and that is why we can't shy off from calling as many children and as many parents and as many Kenyans to bring out their children for vaccination. But by the time we get to that age when these people will be children of, I mean, women of reproductive age, all of us can join our hands and say, we started it, we have made it, this is our generation. Knowing how treatment of cancer is, how not everybody can be able to afford. Here and there we are hearing women dying because they cannot get support anywhere, or they drained the resources that they had. They're calling out for harambes, they are going out the country to go to look for for support or for treatment. We are so anxious waiting for this generation of from 2019, the time they will become women of reproductive age. We hoping for the best. Mm, mm. Thank you, Chela. Because of our traditions and culture, women are usually held at the back bench. So anything coming for women, it's like why women? And we have had such questions even when we go to schools. But I want to appreciate that even as we go to schools, and possibly I should allude this, and the people can search data. Kenya, we are giving to our girls only because of the limitation of the vaccines that we have. Otherwise, you go to other countries, and possibly people can check data, because data is there from WHO and any other health entities. In other countries, they give the vaccine to men, to girls, and even to boys. But in Kenya, because of the limitations of the vaccines that we have, we just focus on giving to our girls alone. So because of the culture, the African culture, women are usually at the back bench. So anything coming by the name of a woman, sometimes it is not usually bought very well. The other thing is, it is in the African culture, it is men who are providers. It is men who are the head of the families. It is men who make the decisions. So the decisions that they would make for the women in their culture, or in their group, or in their community, it remains. Sometimes women would be hearing what we are teaching tonight, and the following day she would be willing to take her 10-year-old girl. But who is the decision maker in the family? Who will be there to provide the bus fare for the mom and the girl to go to the facility? But we are encouraging men and to always come on board, and and that is why we are focusing. Even when we go to schools, we don't empower our girls alone, because even by the time the girls I'm calling from 2019, they will be getting to marriage, they will be coming together with the boys that they are together in school. So we are focusing on empowering our girls and our boys. So our traditions, sometimes they look down on men, I mean on women. And that is why sometimes even the culture, when you talk when you say that you're taking the vaccine to the girls alone, it will always be looked at like, why the girls alone? And if we don't empower our men, they will not be there to say, I am looking forward to a time where we shall see men hearing a message like this, and the following day the papa will be arising with a daughter who is 10 years old, taking her to the facility, looking forward to seeing her daughter after some 20 or 10, 20, 15 years becoming a woman, that she will be free of cervical cancer. We have seen women suffer direly in institutions, No man is coming on board possibly to check on them. Even their own sometimes are left behind because of the traditions. The girls are sent away with their grandmothers, with their aunties, and the papa who is the provider possibly of the resources that they may need is nowhere to be found. But I want to appreciate that men in Kenya are changing. Go to the institutions where we are taking our children for the clinics, you will find that men accompanying their women to come and get the services for the children, the child welfare clinic, the women who are coming for their antenatal clinic, you find men accompanying them, the women that are coming to deliver, and our institutions are becoming smarter and smarter every day, that when men come to accompany the women in the maternity, we can provide a space where a woman who has been accompanied by the husband can labor alone and the husband can be around there to give her psychological support. When you come to the clinic, we have some services that we are offering to men who are coming on board, that when mama is taking care of the baby, the child is going for her child welfare clinic, the mama is going for her family planning clinic services, the man can also get some services in our institutions. And that is what we are focusing on, that when this man comes on board, he will not just accompany these children, I mean the family. He will come, we can take his weight, we can take his blood pressure, we can take his other vitals, so that by the time he'll also be going home, he will also have been checked, like the way we checked on the baby, the way we checked on the mama. So the traditions are a hindrance also. There are communities who also don't believe in going to the hospitals, and these people, whether they get sick or home, they will use their traditional medicines to treat their children. Some communities, they do not even take their children to the schools. So even when we focus on reaching out to the schools, we cannot get these children. But I appreciate that through the primary health, the primary network in the PHC, primary health care networks, we are able to reach out to the communities by having outreaches. We have decentralized, or we have shifted our services from just waiting for our clients in the hospitals, but now we are reaching out to them in the market, in the institutions. We can go at the church and camp there and have women have their services there, and men. We can move and go to the market during the market day, pitch a camp there, or use our Beyond Zero tracks and let our community come and access the services. We can be able to do also house to house services to our clients, like taking the blood pressure in at the comfort of their homes, doing the blood sugars at the comfort of their homes. And then after doing these services, we can be able to link our clients from home to the nearest health facility, which we call a spoke. And then in case they need further investigations, they can be moved from that spoke to the other higher institution, which we call a hub, where they can get more advanced services. So still with the community challenges and with the community myths and misconceptions and the traditions, the services are coming nearer to the community. That when they see us camp in their community for 2 days or 3 days giving them community services, they can as well be able to come and get the services nearer them. We can also be able to go to their doorsteps. We are having the community health promoters who are their neighbors, people that are attached to their communities, who sometimes help us to reach out to the community, find out the issues that they are having, and then they can come for the technical people who are also able to reach our clients in their doorsteps. Yeah. Thank you, Chela. I don't understand very well what we mean with the word normalize, but I guess you want to mean they can make it routine. They Okay. Mhm. Uh-huh. Thank you. I get it. Normalizing the conversation, not the HPV. Thank you. So, the way they can be able to normalize the conversation, it is by us empowering them. Like what we're doing tonight, we are already empowering a population. The very many people that are listening to us, the very many people that are following you on your walking shando or poetry, these are people that are getting the information. And when we empower these people, and when we do this, because we may not be able to give the whole information that we may need, we may need to give, we do like we trigger the conversation. And when we trigger the conversation, then we expect there will be a conversation somewhere out of walisema hivi, what did they mean? And then we usually give another leeway. When you get this information and you need more details, or you need more information where you can get even a conversation, please reach out to the healthcare workers that are near you, so that we can reach out to the church, come get some few minutes after the Sunday service or during a conference, come and talk to the people, explain to them where they can also have a platform where they can be able to ask questions. In the market, I said that nowadays I do advocacy communication and social mobilization, where we go to the community, we trigger the community, we are able to sit with the community, have a conversation to them about human papilloma virus vaccine, where they can be able to ask the questions like the one we are raising here, and then we are able to respond to them one on one. They can be able to raise their mates, we can be able to give them the technical information and to respond to their needs. So what the community can be able to do, open the doors for us to come and have this conversation with you. And I appreciate. Many times our churches have called us even to go and do screening to their women during their conferences, go do screening even to men for the prostate cancer during their conferences. We have gone and camped into the churches. Many times when we go out to the community, you find the churches, the chiefs camp, the hall, or even an open space where we put the tents. People have volunteered, and many times when we go there, they bring even their resources. They bring to us their tables, they bring to us their chairs that we use. They give us even human resource who come and mobilize their colleagues to come and receive the services. So the thing that they can do, when you get this message and you need to get more detailed information, get in touch with the healthcare provider who is near your area, or even our chiefs. We have empowered our chiefs and our sub-chiefs. Just give them an information that you would like to get more information about human papillomavirus vaccine, and then they will reach out to us, because we have networks that we use together with them, and then we can be able to reach out to the church, to reach out to the marketplace, to reach out to that women group or any formal group in the community. We can be able to reach out. So the way they can be able to normalize the conversation, call us always when you're having your meetings. We will be ready to come. We will be ready to give you a healthcare provider who is a technical person to come and respond to your challenges. We also have spaces like now what we're using, the social space. Open your TikTok, follow. Like Chela, I have tried to follow you lately, and you have a lot of information on vaccination, being the county influencer. So open the social space, those who can be able to open the social space. Follow also in our radio, in our TVs. We are having we are having airtime that sometimes you go to the radio, you go to the TV, that we can be able to reach out to the population. The HPV vaccine is accessible in all our healthcare facilities, the private and the public. And it is also accessible in the manner of primary care networks, that we can be able to reach out the primary health care. We can be able to reach out to the community through outreaches. When we come and we camp there, we carry together with us the human papillomavirus vaccine, that we can be able to get the girls who may be around there and have not yet got the vaccine. So it can be accessed in our healthcare facilities, all of them, including level 2. The level 2 is the dispensary. The level 3 is the health center. There is the level 4 that are the sub-county hospitals. We can also get them in the other levels, that is the level 5 and the level 6 facilities. We can be able to get there. Also, in all our immunizing facilities, even in the private sector, we can be able to get it. We can also get it now in our outreaches through the primary health care networks, where we decentralize or we shift the services from just waiting to the clients in the facility, but we go out to the community or to the market to be able to reach out to our facilities. So I would say it is accessible. Ask for the information, you will get it, and you will reach out to it. Thank you, Chela. It is creating awareness and making sure that the human papilloma virus is available at all the levels of care. That is at the higher level. The policymakers and the managers, they ensure that the vaccine is available at all levels of healthcare where immunization is taking place. And then as the other healthcare workers, and especially us that are working in the facilities or in the community, create awareness, empower people with the information, reach out to all people. When it is also good to be able to ensure that in the population where you are there girls that are 10 years, map out the children that are 10 years old and have not gotten the vaccine. They should be able to get the vaccine. I remember when we did the vaccination from the year 2019, because when we started, we were not able to do thoroughly, having started at that time. For the whole of last year, we have been doing something we are calling the big catch up, just trying to get out there and get those children who possibly missed the vaccine because of one reason or another. Not just only the human papillomavirus vaccine, but we have also been trying to do a catch up for all the other vaccination for our children that are below 5 years. You remember in the year 2019, 2020, 2021, when we had COVID-19, there were so many people that we missed out because of the issues and the challenges that we had during those years. Very many of our children missed vaccination, and therefore our vaccination coverage was a bit low. But from last year, we started doing a project that we are calling Big Catch Up, just to reach out to the population, find out, did your children get all the full vaccinations? And I appreciate Chera, you're also doing it very well in TikTok. You're trying to reach out to these women. So we can still say, if you are out there in your home, your girl is 10 years, she has not yet got the vaccine, please come and get the vaccine. This is already a platform that we're using as the government through the support of our partners to be able to create awareness to the population. Yeah. Now, there are always questions that we ask a mother, which will lead us to knowing the age of the child. For example, possibly the parents that we get and they are illiterate, they may not be knowing the age of their children. We always do an assessment, and then we also have something we call the milestones. You'll know by asking huyu mtoto ako darasa gani. You can also be able to assess the child, and by assessing the child through the milestones, you'll automatically be able to tell how old is this children. You'll also take good in medicine. We usually take a lot of history. Mnasemaga tuko na maswali mengi kama askari, because we ask all these questions to lead us to a diagnosis. That is also a diagnosis. We will ask this mother a lot of questions to be able to ascertain the age of this child if she's not sure. But from where we are and where we stand, from where we start, it is not many women at this age. You will meet a woman who is not having her child welfare card, unless possibly they got an accident and they lost their documents either through some ways. They lost either their documents or their items, and then they do not have the booklet. But we always encourage even such a population, enter into the health facility that is near you, tell your story so long as you are genuine, and then you will be assisted, because this document is very important even as your child grows up. She will need it not just at 10 years, even after 10 years, when she'll be going to other institutions, when she'll be traveling outside the country, and at one time she may need to get a passport. She will need all these documents. And then the other thing we tell people, it is for your benefit. When we vaccinate this child with 10 years, it is for the benefit of this child, it is for the benefit of the family, it is for the benefit of our country. Because when we bring down the numbers of women who are having cervical cancer, we shall have diverted our economy from using all the resources that we have on the management of the sick, but we shall have converted those resources now to building up the economy of our country, to building up our institutions of learning. There are a lot of money that is using, which you would say possibly going down the drain, because you're using it on buying medicine, making a lot of other resources that we need for the very sick. But if we can be able to empower people, to be able to prevent diseases, to be able to take care of their own health, to be able to promote health, we can divert a lot of resources to making up our families better, to empowering our children. I know there are children who have got challenges of going to schools, because possibly the resources they would have used to go to schools, they were used because their parents or their relatives, all the community people were sick, and all the resources that we could have amassed together to take this child in the community to school, possibly we amassed these resources to be able to take care of somebody who is suffering from cancer or any other sickness. So the moment people will embrace prevention of diseases or promoting their health through lifestyle, through diet, through doing what they are expected to do, we shall have averted a lot of resources to empowering ourselves or to making our livelihood better. So the government has a role, and what we're doing already, Chela, we are doing a role of empowering our population. Yeah, yeah. Women are very precious beings. Let me start it like that. Women are very precious beings, made by God in a very unique way. And there is something I usually say that the reproductive health organs of women, they are very rich, very important, very resourceful. And I imagine a woman conceiving, after conceiving in her single body, she nurtures a human being. After 9 months, she brings up a Kenyan who looks like her, or who looks like the husband, or who looks like an uncle or a grandma. What a privilege. I don't know how to call it. What a rich resource that a woman carries. And the richness of the reproductive health organs of a woman are hid within her. And we call them private parts of a woman. So sometimes, and when we want to do the procedures that we want to do to support this woman, possibly to do the cervical cancer screening, to do a breast examination, to do a whole body examination, you see the procedures that we do. So sometimes women will shy off, but I always say, don't shy off when we can do a health examination to you, and then after you leave out the door, we give you a clean bill of health. Go, you are well. Other than waiting until that time when you come very uncomfortable, and you will be asking wataniambia nikue nguo saa ngapi, because of the way you are feeling in your body. But this time when you just come, you are smart, you can come, we investigate you, we screen you, and then at the end of it, we give you a clean bill of light, and we tell you you're healthy. Come back after 1 year, come back after 2 years. So sometimes women shy off because of the simple procedures, but I would confidently want to tell them the procedures are not hard, they are not harsh. It is just a slightly uncomfortable procedure. You get a comfort for 2-3 minutes, and then you get comfort for life. You get a discomfort for 2-3 minutes, or 2 minutes, but then you get comfort for life. And for this reason, I advocate women come for screening. Come, we do a screen to you. When we give you a clean bill of right, you'll come back to us after 1 year, and then you'll have the comfort the whole of that 1 year. You'll have the comfort the whole of those 2 years. You'll have the comfort the whole of that period. Other than waiting. Now, what tunasema Chela, cancer, cervical cancer, or any other cancer is not painful. So you will be infected. It complicates in your body by the moment you go to a hospital because you're having signs and symptoms. This cancer will have gone too far to be reversed. So you may come back to us when you are in the 3rd stage or in the 4th stage. And I said in the 1st and the 2nd stage, we can be able to help you so much. Though even now with advanced medicine, we can even be able to help a woman who is in that stage. But when you come early enough, when you don't have any other sign, you just wake up and say, today I'm going for a healthy checkup. They go and check your cervix, they do a screen, they go and check your breast, they do a whole examination of your body, and then you're given the clean bill of right, you go your way. Or when you come early, we tell you we can be able to see something, a change in your cervix. Can we do more investigations? And then we'll tell you there was an infection. Can we treat? We can tell you we can see there is some lesions for the cervical cancer. Can we treat you early? And then we follow you early after some months, after 1 year. We tell you you had a slight infection or you had a lesion for the cervical cancer, but now after treating you and we have all the procedures that we do, you are a survivor. We do some investigations till you come after 1 year, you no longer have the human papilloma virus with you, you are already cleared of it. Thank you. I would say it depends. And as I say, it depends, especially when you go to the level 2 and level 3, you will get it free. But then when you go to these other levels, because of the technicalities of the items and the resources that we're using and the commodities that we are using to support these women, we have to sustain our hospitals. But then I want to encourage everybody, please register yourself for SHA. There are a lot of myths and misconceptions attached to SHA, but I always tell people, get inside the game. I know very many people have talked about the beneficiary having benefited from SHA. I have also benefited from SHA, and also some of my family members. Please register and then be telling the stories when you are already inside. People are being supported. You go to a hospital and you need some services, and if you have registered yourself with SHA, you are able to get these services free of charge. So as I say, it depends on the level of facility where you go. Please register for SHA. SHA is able to support you to do quite a number of services without paying anything. Don't complain when you are outside, get inside. Just register yourself, and then after our community health promoters who are in the community, they are able to register you for SHA. You can also do self-registration for SHA. Just inquire, you'll get how you can be able to register yourself. And when you register yourself, you will be a beneficiary of SHA. So in one way or the other, could I be allowed to say kwa njia moja ama ingine it is free? Because when you have registered yourself for SHA, and like a person like me who is deducted for SHA through the check-off system, when it is deducted there, somebody else can be able to benefit from the other side from that. So can you somebody register for SHA? And for this month, especially in Nakuru County, in our facilities, you would be able to access some cervical cancer screening services free. In some of our facilities, especially in the levels 2 and levels 1, you will get our services free. We are also having a lot of outreaches. We also have a calendar that we have given of the particular sub-counties. In Nakuru, we have 11 sub-counties where people can be able to reach out for services free, and especially for now, cervical cancer, that we are having January as the Cervical Cancer Awareness Month. Thank you. And I said we are optimistic. We are looking forward for the generation that we started vaccinating in 2019, for the future generation. And I said, and I know God will give me time to live to see that day when we shall be saying we started cervical cancer, human papilloma virus vaccination in 2019. This is the generation, and I said I would approximate this girl who was 10 years then. 15 years down the line, she'll be 25 years. Possibly she'll be a mother somewhere. And this woman survives getting cervical cancer. This will be a great achievement for Kenya and for the world. So the future generation will have benefited that. During that time we will have a generation free of cervical cancer, and that is why we are trying, when we do vaccination, we look forward for something we call herd immunity. When we have vaccinated our children above 90%, we have something we call herd immunity. Herd immunity is that when you have vaccinated, it's kama kuweka hema juu ya a certain place. And when you have this hema, anybody who is under that tent, he's covered, he's prevented, he's not able to get any infection, he's not able to be rained on. So when we will have vaccinated all our girls at 100%, or at above 90%, we can always say that our children have got what we call herd immunity. So we're looking forward that in future, what you're calling widespread HPV vaccination future generation, we are looking forward that all our people can be able to bring their children for vaccination. That at that age, we can say we can brag with a generation that is that is cervical cancer free, because all of them appreciated their children to be vaccinated. Mhm. Thank you so much, Echela. And number one, I would say you being our vaccine influencer, I know we are, or our immunization influencer, I know we are empowering you with a lot of information. And thank you for working together with us, the technical people, that we can be able to give you the right information. And therefore, for one, I would advocate for people to follow your TikTok, because you have the right information, and whatever we are doing together, we are doing as we empower you. I would not shy off to give my number: 07 28 726 450. 07 28 726 450. And as we continue working together with Chera, you will also get my TikTok handle, so that you can also follow me on TikTok. I know soon I'll be hitting 1,000 plus, so that you'll be able to see me live. Thank you so much. My email, if somebody would wish to get it also, it is ngwen70@gmail.com. ngwen70@gmail.com. I work for the Department of Health Services, Nakuru County. Yes. Mm. Mm. You're very right, girl. Let them come up, but they can also be able to empower somebody. So if you got the information, run with it. Be Take care of your own health. Be responsible of your own health. It is for your benefit. So as we conclude, Chela, allow me to tell all those who can hear us, women, please enter the facility that is just near you. Go for a screen this month as we create awareness on cervical cancer screening. If you have a girl that is 10 years and have not yet got her jab for human papillomavirus vaccine, please let her go and get the jab. We empower our nation together. And I said, when we do this and we prevent diseases, all of us are amassing our economy together to be able to better our lives and to better the life of Kenyans. Thank you. Bye. at gmail.com.
Yes.
NGWELEN.
So let me just confirm whether my guest has been able to be familiar with cameras. But Lisa Hodri, I can see you. Thank you. Yeah, so what do you know about me before we begin this podcast? But don't be a bit personal. Don't be. I'm
at gmail.com.
yes.
NGWELEN 70 at gmail.com.